My name is Philippa Matthews. I'm a consultant in infectious diseases and microbiology in Oxford, and I'm currently funded by the Wellcome Trust working on hepatitis B infection. My other interests include graduate and postgraduate education, promotion of equity and diversity through a leadership role in our Athena Swan programme, and working with local primary and secondary schools to enhance engagement in science and medicine. So, hepatitis B virus. The virus was discovered 50 years ago, and we now work in the context of international sustainable development goals that set an ambitious target for elimination of these viruses as a public health threat by the year 2030. For hepatitis B, we already have a safe, effective vaccine and robust drugs that can suppress the virus. So it's easy to approach the 2030 targets feeling that we already have the tools we need for success. But I'd like to present a different side to this story. That's representing hepatitis B as a major neglected public health story and considering some of the challenges that face us. 3 brief points. The first is, let's just consider the burden of disease. An estimated 290 million people globally are chronically infected with hepatitis B. That's 3% of the world's population. And among these, we think less than 10% are aware of their infection. That represents a huge reservoir for onward transmission, including from mothers to their babies, and a burden of liver disease that includes liver scarring, that's cirrhosis, and liver cancer. The burden of this disease falls disproportionately on some of the world's most poor and marginalised communities. Second point, despite best efforts, we're still some way from properly understanding the biology of this complex virus, and that means that new cure strategies are not immediately on the horizon. And thirdly, I'd like to present stigma and discrimination as major barriers both to diagnosis and to treatment for many people with hepatitis virus infection. So can we attain the 2030 targets? Currently, I'm not sure, but with education, advocacy, political will, and investment in basic science, we can make really meaningful strides.